I didn't know if I was going to live or die.
It's vulnerable. Going under, putting your body in someone else's hands.
She was very friendly. She agreed to everything that I wanted done.
Desiree Knight says her primary care doctor recommended certified plastic surgeon Sarah Crandall for her breast reduction in 2021 at St. Clair Hospital. A surgery so routine, state documents claim Crandall had performed it hundreds of times.
Came home the same day and, went to lay down in anticipation of wearing off the anesthesia and feeling a little better, but that didn't happen.
Instead, Desiree says she was sick and unrecognizable and ultimately landed back in the hospital.
I knew something was wrong. They came in and was like, you have 1.5 liters of fluid on one side and 1 liter on the other side, and we have to take you in for an emergency surgery.
Desiree filed a complaint with Washington's Medical Commission and found she wasn't alone. At least 5 of Crandall's other patients had complications too on surgeries before hers.
Why the hell did I let her cut me? Why didn't I do my research?
Crandall wasn't disciplined, though, until years later. The state's order ruled she had an unusually high number of cases with compromised blood supply, deformed breasts, or cell injury. It required her to have her skills evaluated, complete additional training, and pay a fine.
I didn't want my husband to look at me or people to look at me, because you feel like a monster.
We first requested patient complaint documents from the state's investigation in January. Over the last 8 months, we have received and reviewed thousands of pages related to the claims against Crandall.
There are bad outcomes that can occur without any negligence.
Gary Sams has defended doctors and hospitals for more than 30 years, but wasn't involved in this case.
Some doctors have more complications than others. Some do much more difficult procedures.
Through her attorney, Crandall told us she could not discuss specifics of patient care, but has a deep commitment to her patients and works with them to understand the options and risks. State records show Crandall told the commission she was upping pre-op talks about patient expectations and would be more selective to avoid patients at high risk.
Any patient can search a doctor's disciplinary record on the Department of Health website. But here's the problem. By the time Crandall's order came down in Washington in 2024, she had already moved to Minnesota and was practicing there.
The states do not work very well together. They are slow to report findings or conclusions from one state to the next.
It took until March of this year for Minnesota's medical board to issue their own order recognizing the Washington one. Documents show it took about 4 months for Minnesota to develop and finalize that order by late January. And then they had to wait for the next board meeting to adopt it to public record.
How many other surgeries in that due time has she performed and potentially hurt somebody?
KIRO 7 tried to see if any new complaints had been filed against Crandall in Minnesota, but their complaints alone are not public record. As for Desiree, the Washington Medical Board took her complaint but closed it. They told us it so closely matched the others, fully investigating it would have delayed Crandall's discipline. Ultimately, Desiree had to pay $17,000 out of pocket for a new surgery, and she still doesn't feel entirely healed.
If I can be the voice for just one person, just so that this doesn't happen to somebody else.
By law, states are required to report certain disciplinary actions to a national database. Hospitals are required to check that both up front and on an ongoing basis. The lag can come when those violations take place in between those mandatory checks. Crandall did not tell us if she's currently working anywhere. You can read her full statement, plus what St. Clair Hospital had to say about their patient complaint process. That's all online on KIRO7.com. In Lakewood, Madeline Ottley, KIRO 7 News.